The Agency for Healthcare Research and Quality has discontinued dozens of active research awards, pulling funding from projects already underway. The New York Times reports that the agency, known as AHRQ, is an arm of the Department of Health and Human Services. It funds research aimed at making healthcare more affordable and accessible. Until recently, it had slowed new grants. Now it is stopping existing ones. Amy Waterman, a researcher at Houston Methodist Hospital in Texas, learned on July 15 that her 3-year kidney care program would lose its funding. Her team had developed a method to identify patients at highest risk for kidney failure and built tools to help families understand the benefits of early transplant. The program was ready to launch in several California clinics. Waterman says the work matters for improving care, and now it is totally uncertain whether they can continue. She is not alone. Academy Health, an organization tracking the grants, says the targeted projects range from reducing antibiotic overuse to improving children's asthma treatments. Academy Health President Aaron Carroll calls it real work that affects people. When these investments stop, he says, clinicians and patients feel it, not just researchers. The move fits a broader pattern across the federal government since the Trump administration took office, changing how science is funded and conducted. AHRQ typically awards grants through competitive review and disperses money in installments over multiple years. Researchers submit progress reports each year for renewal. Carroll notes that most projects continue, and midstream terminations are usually for cause or a specific purpose that researchers would know about. But the scientists who spoke to the Times say they submitted reports last summer and waited months for the next installment. Last week they received letters stating their grants would be discontinued. The letters did not give specific reasons. Instead, they said the agency was adjusting its award portfolio to better prioritize resources, listing priorities such as patient safety, preventing antibiotic resistance, and using digital tools to improve health. Several researchers say their work falls squarely within those priorities. For now, the future of these projects and the patients they aim to help hangs in the balance. This has been a summary of reporting by Katrina Miller for the New York Times. Thanks for listening.